folks. Welcome to our segment, Healthy by Choice. I am Dr. Michael Epitropoulos. Next to me is Dr. Cal Streeter. We are coming to you on a Wednesday evening, running a little late because of technical difficulties, but we're on air now, and we welcome you to join us. Invite your friends, family members, because we're talking about a very powerful subject, being the thyroid gland. And this happens to be the second part of a series that we're doing on Wednesday nights on the thyroid gland. Those of you who do not know Dr. Streeter next to me, Dr. Streeter is an osteopathic physician who's been practicing for about 45 plus years. He is currently the medical director working with the Amish populations of Michigan, Indiana, but he is a pioneer in using natural medicine and affecting the ability for the body to activate it, to heal it, so it begins to heal and repair. And as Dr. Streeter says, he stopped being a doctor and let the body be the doctor, is one of his famous quotes. And I'm really honored to have him with me on Wednesday nights. He's been my mentor for many years. I owe a lot of gratitude for Dr. Streeter for what I do today in my work as a functional medicine physician. So with that, Dr. Streeter, welcome tonight. Good to see you.
Good to see you. Good to be here.
And you're up there in Indiana, right, Doc?
Yes, sir. In Northeast Indiana.
Northeast Indiana. So you're in that Great Lakes belt, aren't you? And that has a bearing on the thyroid. Why don't you explain to everybody why the Great Lakes is not the greatest area to live because for the thyroid's health?
Okay, the Great Lakes region is called the goiter belt because 50, 75 years ago, most ladies had goiters. Well, ladies are more prone to thyroid problems than men. The only way a man gets to have thyroid problems is if mom had thyroid problems anyway. Okay, we don't have as much. Men don't ovulate, thank God. when ladies ovulate, they use thyroid. If they don't have enough iodine to replace it, then they have a thyroid deficiency. And that's why ladies have the problem with thyroid.
I think you also mentioned that women, because the breasts are utilizing 2 to 3 times as much iodine, correct?
That's right. That's correct. Mm-hmm.
So there's multiple reasons why a woman today would be very iodine deficient and as a result have thyroid problems.
That's exactly right. Not only to mention the fact that there's so many competitors for iodine that people have trouble absorbing it. Mercury, okay, to some extent aluminum, and the perchlorates from the rocket fuel, okay. Anybody that eats fruits and vegetables that are irrigated from the Colorado River are exposed to perchlorate. And that's why those people are so deficient in iodine, because perchlorate's a competitor against iodine.
So really, depending upon the region a person comes from, there's some type of deficiencies that are affecting the thyroid, obviously, whether it be the, like you're saying, the chemicals in the water. We know the foods that are adulterated and chemicalized.
The medication.
I'm sorry?
Medications.
Medications, well, there you go. That's a big one right there, right? The medications are causing the body to deplete of thyroid, of iodine.
And cosmetics. Many of our antiperspirants and deodorants have competitors for iodine. That blocks the body from absorbing iodine.
Why is the medical profession not trained to properly diagnose and deal with the thyroid?
Because they're in the chemical business, and chemicals don't treat a problem. They help you live with the problem. Okay? If you're trying to get over a problem, chemicals will never get you over it. And they have the medical profession has a patent on Synthroid or levothyroxine. Okay? And that's just part of what the thyroid produces. And that shuts the thyroid down.
When you
Okay?
consider the fact that women particularly are placed on these medications for their entire life, obviously, right?
That's right. That's
And
right.
unfortunately, the downside is that, as you said, it's going to have, over the long run, obviously, a more negative impact on that gland than a positive one, right?
That's right.
I mean,
Doctors are trained by PhDs and by doctors who are trained to feed the pharmaceutical company. They're funded by the pharmaceutical companies. Okay.
So we're ending up then with a gland that is not being properly taken care of, not really addressed, especially as it relates to iodine deficiency, which obviously is the foundation of that gland being healthy or not, right?
Right.
And as a result, we have a population, it sounds like to me, Cal, and we discussed this, that we're talking about a significant amount of people, both men and women, particularly women, that are suffering with thyroid problems.
Yeah, they're suffering from iodine deficiency.
And the iodine,
Dr. Bronstein wrote a book from Detroit, Michigan. He's an MD, and he's in integrated medicine, and he wrote a book, Why Your Body Needs Iodine and Can't Live Without It. Okay.
so what we want to emphasize tonight, as we started to do last week and will continue to do in this series, is really our conversation is revolving around iodine deficiencies and how to address them, and discussing how to really simply, by doing the things that we're talking about, ladies and gentlemen, are ways that are going to revitalize and restore and rejuvenate your thyroid, get it healthy again. And you're going to see the implications of that, because certainly the thyroid's implications are far-reaching, Cal, when we talk about the different organs of the body, right? So, for example, the thyroid affects the heart, correct?
It affects every organ in the body.
Every organ in the body, from the heart to the immune system,
You bet.
to the nervous system,
Yes, sir.
to the digestive system,
Yes, sir.
to the genitourinary system,
Yes, sir.
to the hormonal system.
Every one of them.
Every single system of the body, you've got this gland that's the shape of a butterfly, and it is the master gland.
It controls metabolism. Okay.
And that is a magic word for folks listening in tonight, because the magic thing is for everybody is weight and losing weight, having weight, how to lose the weight. And you said, here is the gland that is the metabolism regulator, and that's where the weight issues begin, right?
That's right. That's exactly right.
So
you get a sluggish thyroid, you're going to have a weight problem.
you've got a sluggish thyroid, you're going to have a weight problem right now. And no matter whatever weight loss program, and there's so many of them out there, as you know, it's a multi-trillion-dollar industry, right?
Right.
And they're sending people from packaged foods to, that's always been the big one. I can't mention any names, but these programs all revolve either around packaged foods that they send you, to some psychological type things, to this, that, and the other. But bottom line is, if your thyroid is underactive, if you've got iodine deficiency, you're not going to lose the weight or especially keep it off, right?
That's right. That's why you have yo-yo weight loss program. up and down and up and down, up and down. Unless you address the thyroid, you're never going to get anybody well.
So when a patient presents for the first time in your office, Cal, and they're coming in and, you know, and when we look at the thyroid and the symptoms now of a thyroid that there's a particularly underactive, you know, the number one thing would be obviously what? Hair falling out easily, dry hair, right?
I do a total history on every patient that comes to my office. And I start out with the digestive system, constipation, diarrhea, nausea, vomiting, then the genital urinary system, urinary frequency, okay? You know, menstrual irregularities. One of the first things you see with thyroid deficiency is menstrual irregularities.
Menstrual irregularity.
You find a lady who's infertile, can't get pregnant. You give her thyroid, a lot of times that's all she'll need. You can't put out a mature egg unless you have a healthy thyroid.
How about when they, to discuss with you, one of the biggest issues, of course, the symptoms of, you know, when your female patient will say to you, I can't lose weight, it doesn't stay off.
I know.
Thyroid is involved.
We discussed that. I discussed the digestion. One of the first signs you have of thyroid issues is constipation or digestive issues.
A big one is constipation, digestion. How about brittle nails, cold hands and feet?
That's right.
Depression.
Yep.
High cholesterol. How about high cholesterol and thyroid, Cal?
Yeah, cholesterol imbalance. I'm not so worried about high cholesterol as I have imbalance. If you have high cholesterol and low HDL, then you don't have a detergent that keeps cholesterol in suspension. Okay?
But that could be coming from the thyroid being underactive, correct?
That's exactly right. That's exactly right. And you talk about joint pain and leg cramps and that sort of thing. I go down the line about musculoskeletal problems. Okay, we talk about heart problems. You have irregular heart, slow heart, racing heart. Okay, high blood pressure. Many of those are caused by thyroid issues.
You know, when you mention those type of symptoms, we're talking about a majority of the population that has those symptoms, particularly, for example, your cholesterol and then the HDL. And so how many of those folks instead are put on statins immediately?
No dangerous drug on the market.
Where there is no immediate, in other words, they're not looking at the thyroid at all, but we're going to put the patient right out of the gate on a statin drug.
Everybody treats symptoms, okay? We're trained to do that in med school. That's what you learn to do. You learn to treat symptoms. You don't treat causes. That's why I say I never play doctor. Let the body play doctor. It knows what to do. If you find out what it needs, give it what it needs, it'll get you well.
Yeah, and another example of a common symptom that a lot of folks have, fluid retention, which is a thyroid, underactive thyroid symptom, right? When they're getting edema, they're getting mixed edema in their tissue in the other areas. Right away, what do? They want to put them on a diuretic, right?
That's right. Skin rashes and skin breaking out. Okay.
Underactive thyroid, right?
Yes.
How about even the point of memory? How about cognition?
That's right.
Connected to the thyroid, correct, Cal?
Exactly right.
I mean, we see an epidemic now of Alzheimer's and dementia. And how many of those folks have a thyroid that's underactive?
I know. Three areas you have to concentrate on if you're going to get the thyroid balance. Thyroid, adrenals, and hormones. You have to get all three of them balanced in order for the thyroid to work right.
You know, the other thing that people complain a lot about, Cal, and we see it all day long, is fatigue.
I know.
And you've got people that are exhausted, and
Right.
those that are really exhausted, and we know that's a prime underactive thyroid symptom,
Exactly right.
right?
Thyroid and adrenals, and you'll get your energy back.
I think I mean, again, we could go on and on that's why we're doing this as a series when we're talking about the thyroid, because the outreach, the implications of this gland are so vast, so significant, that it's a multiple health segment topic, right?
Right.
So now that they've come in, we've gone over the case history, they've listed these symptoms, many of which we've covered. And we are now going to decide, first of all, we've got some basic things that we would have them do. Of course, now, one of your things that you look at, of course, is going to be their blood test. And then, again, that's where the medical people are falling short. So, Cal, you're looking at, again, if you would review, what markers are you looking at for them? What thyroid markers?
Well, the first thing I look at is basic metabolic temperature. I have them take their temperature before they get out of bed in the morning. If the temperature's below 97.8, they're thyroid deficient. I don't care what their blood test says. Okay?
So that's a really important point to really to make and to emphasize that those that are watching us tonight, that just by getting a morning reading, a temperature reading, right, Cal? The first thing they do before they even get out of bed, right?
If they're menstruating, the first 2 days of their menstrual period, that's when their temperature's accurate. And they take their temperature before they get out of bed, either the first day or the second day when they're menstruating, and they'll find out whether their thyroid's working all right.
And what if now we're beyond menstruation, the gals that are older that are not menstruating anymore with their temperature?
Take it anytime.
Oh, I'm sorry?
They can take it anytime. They'll be like men.
So for you gals listening to us tonight, if you're beyond where we say obviously gone through menopause, first thing in the morning, take your temperature, and it should be a minimum of 97.8. And then the other thing, Cal, about the stain, doing an iodine stain, there's the iodine deficiency test. You have them do that as well, right? That's
right. You take betadine, you get the dark iodine that they use on the farm and they use for antiseptic. You put that on your abdomen, and if it's gone within 12 hours, you need more iodine. And I always use 5% iodine solution that's 6.25 milligrams per drop, okay? And I have them start on that, and most ladies need 4 drops or more. It takes 25 milligrams for a lady to have a healthy thyroid.
So we're talking about, first of all, folks, again, listening, that you're going to get to betadine, to use the betadine to see how long that stain, rubbing it on your belly, or even I have them also, the wrists, outside of the wrists, and you're going to do that first thing in the morning. The same morning, you can even do your temperature test, and you're going to see that it's a measurement to see how deficient of iodine you are, which is critical to your eating. The thyroid needs the iodine, so that if your stain is remaining for a minimum of 12 hours, and that's a good indicator for your thyroid. But most times, folks, that stain is gone, oftentimes in 4 or 3 hours less. In fact, Cal, I've had patients that have put that stain on, and it was gone in 5 minutes.
I know.
5 minutes. And I'm sure you see the same thing. That's how, obviously, I know we're living in a population, as you pointed out earlier, depending on region of the United States they're living in, they're going to be significantly iodine deficient for multiple reasons.
Well, iodine and selenium convert T4 to T3. And T3 is the active thyroid. It's the most important thyroid test you get. If your doctor does a thyroid test and he does a TSH level, that's what most of them take, is TSH. Because TSH tells you what T4 you're getting. And since most doctors prescribe levothyroxine or Synthroid, they're not interested in anything but TSH. Okay?
That's all they're thinking about is the T4 you're getting.
That's right.
But they're not, you got to go beyond the T4 and get to the T3.
That's right. Free T3 is the most important test that you'll do when you do a thyroid test. If your doctor does a TSH and a TSH and a T4, free T4, and he doesn't do a free T3, he doesn't know what he's doing.
So you folks listening, remember that the TSH, the most common thing you'll see down in your blood test your doc has done is that TSH or T4, but you're not getting the full picture unless you're seeing that T3, free T3, because that's showing that that T4 is converting, right, Cal,
Right.
to the T3. Then that conversion has to happen. And what a lot of what we do in our work using natural therapy is to help the body convert, correct? You go from that T4 to that T3, is that's showing what, Cal, that that thyroid now is starting to engage, right?
That's right. T3 comes from T4, and selenium and iodine combine to make up thyroid peroxidase that converts T4 to T3.
Important point, folks. Again, selenium is a mineral. Oftentimes very deficient in our soil. Our body needs it significantly because of that soil deficiency. But the selenium combines with the iodine, two things that your body is already extremely deficient in. The combination of the selenium and the iodine is critical for the thyroid's ability for that conversion to happen from that T4 to that T3.
That's right.
And the inability of that conversion to happen is the cause of a significant thyroid problems. Correct, Cal?
That's exactly right. If that doesn't happen, a lot of times the immune system will kick in to try and help you. Instead of helping you, it'll attack you, and that's thyroiditis. That's Hashimoto's thyroiditis.
So the thyroiditis is really a sign that the thyroid now is almost like it's almost like it's dying on you. I mean, in other words, it's becoming very.
It's under attack.
It's under attack. It's becoming inflamed. It's under attack, right?
Well, the immune system is trying to help you, and instead of helping, it attacks you.
The immune system is trying to overcompensate for the inability of that T4 not converting to T3. And if the overcompensation of the immune system is creating now a problem, and now the thyroid is going to become very inflamed, and as we call thyroiditis.
Yep, unless you get that TPO, that thyroid peroxidase antibody, or thyroid globulin antibody back to normal, you're never going to get the thyroid corrected.
So in other words, yeah. So the point of this is, folks, what we do then to help that conversion happen, we make sure you're on a supplement, correct, Cal, that contains the selenium in it in combination with the potassium iodide, right? Mm-hmm. And also tyrosine, right, Cal? Because the tyrosine is important.
That's right. And a lot of minerals. And a lot of minerals, because what we call them cofactors need to be present for your body to allow this conversion to happen. And so one of the things we put you on a program that includes a supplement that contains these cofactors in it. Remember, right, Cal? That's right.
And we oftentimes utilize, Cal, if you would explain, we also use a tissue glandular for the thyroid as well. Would you explain the importance of the use that tissue glandular actually is so powerful that it's one step below even what the medications can do? In other words, if we explain the tissue glandular, the importance of it to the thyroid.
That's
like,
right.
for example, ecothyroid 37, the milligram one, or the 127. Can you explain a little bit about tissue glandulars?
Well, here's the thing. There are no two people exactly alike. Okay? If you could get a natural product that your body can use without any outside interference, it will make the necessary corrections. Okay? We've got a couple of thyroid products at Northern Nutrition. Thyroid HP Thyroid HP has 50 milligrams of thyroid extract in it. It has iodine, it has selenium, it has all the cofactors you need to feed the thyroid. If that works, it's one of the most successful thyroid preparations we got at Northern Nutrition. Now, if that doesn't work, you can go to Ecothyroid. I take Ecothyroid 125 with a little bit of T3 every day of my life, okay? Because Ecothyroid is beef thyroid, and I like that better than pork thyroid. And I don't have to fight with the pharmaceutical companies about whether they're going to approve it this week or whether we can get it this week or whether they're going to shut it down this week. Okay, there's a constant battle with the pharmaceutical companies trying to force people to take Synthroid or levothyroxine. All right, constant battle.
So we can review this for those listening. And in our office, Cal, we're either using of course, you mentioned the Thyroid HP. We also use from a company called Nutritional Frontiers, their Iodine Plus, which also has the tyrosine and the potassium iodine of We also have the Orthomolecular has their Thyrotane. So we've with Dr. Streeter and I have kind of course, the Ecothyroid is the glandular. We also implement, and Dr. Streeter made reference to it, it's called Lugol's iodine, right, Kel, that we also implement to try to get.
Lugol's thyroid has been made a class drug now, so you have to have a DEA number to prescribe it.
I didn't even know that.
Yeah, recently it's come out. They've done that.
Now think about that, Cal. Why did they do that for?
Because they want everybody on Synthroid.
So they didn't want something to be too effective that you could get naturally, right, without a prescription.
That's right. If you're taking a thyroid extract, okay, and you're getting iodine and selenium,
right,
there's a 50-50 chance that your thyroid will come back to work again.
Right.
And if that happens, you're not going to sell any thyroid.
No, you're not.
Or Synthroid.
You're right. You're going to have a competitor to levothyroxine and Synthroid, which I think probably most of America is on one of those too, right?
That's right. We don't want anybody to get well in America. We want them to stay a little bit sick so we can work on it.
There's no money, I always say, there is no money in eliminating or curing. There's money in maintaining illness, not eliminating it or curing it.
Right.
And why we're tonight here with you folks, as we are every Wednesday, is to give you the information, empower you to learn how to eliminate and cure rather than just to maintain. Because you can be maintaining crisis, unfortunately, which is our system is based on a sick care, crisis care system, and that isn't going to see any kind of improvement in health. But when we have a system of care that Dr. Streeter and I and all doctors that are aligned with us throughout the United States that use the body that recognize the body is the doctor, the body has the ability to heal and repair and rebuild, and the different tools that we use to accomplish that, then you're truly seeing healing. The ability of the body to heal, and you're seeing it happen firsthand, right?
That's right. Now, the biggest deterrent to health in America is the insurance business. Okay? Medicare, Medicaid, insurance is killing us. Okay, because they won't treat anything but sickness. You got to have a sickness code in order to be treated. Okay?
You do have to have a sickness code, and that's what they are. They're sickness codes, and unfortunately, too, the whole premise of insurance companies is because of that. You have a false. It's kind of you're lulled into this false thought that you're getting healthy, but you're just dealing with symptoms. They're covering protocols, treatments that just treat symptoms, that just nurture the sickness, maintain the sickness. And the bad thing is the mentality through the years has been where people were not involving themselves in their own care of their body. They were not proactive.
Right.
And what I'm seeing today more than ever, and I'm sure you agree with this, Cal, is we're seeing a change in the thought process people are having now, where people are becoming proactive in their health more than ever before. And I think the COVID issue has had a lot to do with that, where we recognize the fact that when something like this can attack us like it has, that we need and have to fortify our bodies to get our bodies able to handle, to take on whatever the invader is. And the body has that ability. It has that ability. And we're recognizing it more than ever now and seeing it as a necessity because of how COVID has put us in the corner, that we have seen it now as a necessity that we must be proactive. We must fortify our immune systems. We've got to get ourselves to be able to counter it. And the beauty is that the body has that ability. And also the beauty is that we have so many incredible nutritional formulas out there that are from nature. All of them are from nature, you know?
That's right.
And we have them right at our fingertips, if you will.
Well, medicine has no treatment for COVID. Okay? There's no successful treatment out there for COVID. And the insurance companies aren't going to pay for anything if they can't prove that there's some degree of success. All right? Now, seldom a day goes by in my office that I don't have somebody, even though they know I'm in integrative medicine, I'm in health and functional medicine. Seldom a day goes by somebody doesn't say, well, my insurance pay for that. If my insurance doesn't pay for it, I can't get it.
And that's the curse of the insurance mentality, unfortunately, that, you know, the powers that be want us to be, or people to be in that mentality. But I really believe, Cal, that that's changing. The attitude is changing, that people are becoming more proactive, saying, you know what, this is my health. This is the most important thing that I have. And I must, and I will make sure that I'm as healthy as possible and do whatever that takes.
I have patients that drive hundreds of miles to see me because they know they'll get functional medicine and not crisis medicine. Okay? On the other hand, I had a patient the other day go to a doctor, and he said, who are you seeing? And she told him who she was seeing. He said, you don't come back to see me.
We're the messengers, Cal. You know, as we know, the healer is Jesus Christ. He has us as his instrument, and we're his instrument, and we're giving the information that we've been given through the years.
That's right.
To empower our patients
Exactly.
to activate the doctor within.
That's right. That's
right?
right. That's right.
And the whole purpose of even us doing these health segments, folks, is that because Dr. Streeter and I have been blessed to be able, have been doing this work for many years together, that we have been blessed to also be able to see a lot of things and gather a lot of information, and want us to really continue to give that out to you folks, to empower you, because the way the system, unfortunately, the crisis care system, as I like to call it, isn't doing that job for you all.
Yep.
So we feel like, and we're blessed to be able to, you know, oftentimes, and I know they tell you the same thing, Doc, Cal, you give me hope, you give them hope.
Yep.
That otherwise no one else is giving them.
Yep. I see a steady stream of cancer patients, and it scares me to death.
Well, let's talk about that for a minute, Cal. Why? Why is cancer becoming more significant than ever? Why? It's been estimated now we're at about 51% of our population at one time or another will be diagnosed with cancer. Why is that?
Cancer is not a disease. Cancer is an immune weakness. All of us have cancer cells in our body. If the body loses the battle, you get a buildup of cancer cells in your bloodstream. They land in a weakened area and form a tumor. The tumor starts to produce hormone-like substances that we call tumor markers. to keep the body from recognizing a tumor or something it ought to fight. Okay? We don't have a cancer system in America. We got a tumor system. And as long as we got a tumor system, we're never going to get anybody well. Okay?
So from your vantage point, as far as cancer is concerned, and as you said, we all have it in us, whether it takes hold of us or not, as you're saying, is your immune system allows it to happen by being very fatigued. So we have a population, obviously, because of the sick care system not promoting wellness care, we have a population of patients with a weakened immune system, right?
I've got a three-pronged program that I use for cancer victims. I stimulate their immune system. I detoxify them first. For a couple of months, I detoxify them with natural detoxes. I stimulate their immune system with natural products, and then we knock down the disease without knocking them down. There's a book out called Tomorrow's Cancer Cures Today by Alan Spreen. What is it? 35 cancer treatments from around the world. Okay. I give a list of 25 things that patients can choose from that they want to do for the rest of their life, and they choose seven of those items that fit their pocketbook and fit their taste buds. I don't want my patients ever getting up in the morning and say, yuck, not this again. I want them to get up and say, hey, we can do this. And all of those programs work.
And it seems like the common thread of those programs have to do with A, detoxifying the body,
Yep.
B, stimulating the immune system.
That's right. And knocking the disease down without knocking the patient down.
And knocking the disease down and making the body the most unfavorable host to the disease. And that's how you knock down the disease, right?
That's exactly right. That's exactly right. There's herbs and natural preparations that will knock the disease down without knocking the tumor down, without knocking the body down.
Because unfortunately, the way the traditional system is set up of chemo and radiation is it's knocking down the body.
That's right.
Right?
I had prostate cancer for 20 years. I could not find a urologist that thought like I did. My first PSA in 1971 was 74. 4 is normal. I went to a urologist and he said, well, you come back next week and we'll do an ultrasound and biopsy. I called my brother, who was chief resident urology at the University of Chicago for a year. I said, here's what I got and here's what this guy wants to do, Dennis. What should I do? He said, run. I said, where? He said, away from that guy. I'll find somebody to do your ultrasound. Tell him to put his needles in somebody else. It took me 20 years to find somebody that thought like I did. My son was in a class for disgruntled doctors, a master's class down at Indiana University. And the head of the urology oncology department was in that class. He said, you send your dad to me, I'll take care of him. First guy that thought like I did. He said, if we see anything in that prostate at all that looks suspicious, we take it out. He said, before it spreads anyplace else. He said, I've done over 10,000 robotic prostatectomies on veterans and twice that many on non-veterans. In 20 minutes on a Friday morning, they did a robotic prostatectomy on me. No cancer anyplace but in the prostate. My PSA went from 190, the highest I'd ever seen, to 0.33 in 3 days.
Well, again, you see, it's a matter of being informed.
Yeah.
Informed is everything.
And you know what he said to me? He said, now, when we take that prostate out, if there's anything outside the prostate, we'll radiate it. I said, how much radiation does it take to kill a cancer cell? I said, what do you mean? I said, well, that's living tissue. I said, if you could give me enough radiation to kill a cancer cell, I'll look like a potato chip. He said, we don't want to do that, do we? I said, I don't know about you. He said, why don't you start drinking pomegranate juice? That's as good as the radiation. He knew that before he told me about the radiation.
That's awesome.
Okay, so there's things you could do
Yes,
that are successful and
yes,
less damaging
yes.
than what the medical profession does.
And it's a matter of just knowing about them. And the only way you know about them is doctors like us who
That's right.
spread the word, right? And
That's
that's
right.
what's expected. What's it say in the Bible? That those that have much, much is expected.
That's right. Two problems we have. We don't get the patient until it's dead end territory. It's run all over the place. Or we don't get them until the medical profession has burned them up or poisoned them until they don't have anything to fight with. Okay? If you give me a patient when they first suspect cancer, the body will get them well. It wasn't like a doctor's radiation and chemotherapy that got them the problem. Okay? Now, that'll get you and me in lots of trouble. Okay? Because we're fighting economics.
Yes, it is, and we are, but that's okay because you know what? I mean, the truth sets you free. And you know, when we speak of the immune system, you know, again, as we were tying this into the thyroid conversation, again, the importance of the thyroid too is the impact it has on the immune system, right, Cal?
That's right. I fought this battle in 1992. The FDA came through my office with guns drawn and acted like fools, okay? Because I had cancer patients that had 3 months to live, and 5 years later, they're still alive. You can't do that in America. Now, my judge got 3,000 letters from my patients. Okay, he retired after my case. It's right on the court record. Don't ever bring another Streeter back in the federal courtroom. They got more friends than we got. Okay? But the federal government doesn't care. If they come after you for something, all they want is a conviction. They had a couple things they were pretty sure they could prove and they couldn't. But they had 12 or 14 frivolous things. They knew they could prove one of those. I cashed a $10,000 check to buy nutrients out of Mexico. That's money laundering. I spent 18 months in a federal prison for money laundering. Okay? Trust me, they'll never attack me again. Okay? They know better. And you know why that happened? I got a friend who did research on it. The Clintons ordered Janet Reno to attack quackery, and I was the first quack they came after. Okay? They come after me again, those people better have their bags packed because I'm going to send somebody to prison where I was.
You know, Cal, you're probably the most principled person I've ever known in my life. You have paid the ultimate price because you have truly, as a doctor, want to help people, to give them your complete effort as a physician. And because of that and the politics, unfortunately, that we've had in this country, which have been more pro for the way the pharmaceuticals, just them ruling, but things are changing again. I mean, you've had to pay a price for us to be where we're at today, Cal, because of what you have done. And I mean, you're, like I said, you're truly a pioneer.
Yeah. Well, I witnessed everybody that comes in my office. I've got a stack of tracts on my desk and a King James Bible on the corner of my desk. And I ask every patient before they leave, are you 100% sure you're on your way to heaven? Okay? And if they're not, I give them one of those tracts and I say, look, don't take a chance on that. Don't take a chance on that. And the one thing we're fighting in medicine and every place else in our society today, are we a godly nation? Are we godly people? Or are we ungodly? Okay? Do we have a God that knows what he's doing? When I went to prison, I didn't take that as punishment. I had a long talk with myself before I got to prison. I said, now, dear Lord, it's not these people's fault that I'm going to prison. Help me to be what I should be as a Christian and as a citizen, as a human being. And I acted like a gentleman when I got into prison. And they were shocked. They were shocked. They said, you're the first professional that's ever come through this place that acted like a human being. Most people that come here have an attitude. Okay? And I went in there, I said, this is not my fault. This is God's fault. This is where God wanted me to be. God never looks down and says, oops. Okay? The things he put me through is right where he wanted me to be. Okay? And I never accept things as, hey, this is punishment. This is terrible. This is what God had for me. Okay? Now, if you do that, he doesn't look down and say, well, I don't know what's going to happen today. He knows exactly what's going to happen. Okay? And the body we live in, he made.
Yes, he did.
Okay? So I have no problems. I'm not a faith healer, but I have a lot of people get well. Okay? Because I've got a lot of faith in the body God gave us.
And it doesn't let us down. It is a temple that we're housed in, and we have to be good stewards of that temple. And as we are good stewards of it, that it will return the, as we call it, the return on investment being proactive and taking care of it. And truly it will serve us well with a quality of health and a quality of life. And I would say that, as you said, Cal, we've got to, each of us, to rely on our faithfulness, our faith, obedience. And the fact is, to give our bodies an opportunity to heal and repair and rebuild the way it's been intended to.
We're the most unhealthy nation in the world, and we spend more money on drugs and medication than any nation in the world.
Sadly so, and I think that, again, the time now is of enlightenment, that we are beginning to recognize things, see things for what they are, as it relates to our body and its ability to heal and repair. And tonight's segment, just as we are doing each Wednesday, is to give you folks listening the information that will empower you to really activate your body's healing ability. And nothing is more perfect example of that is utilizing the information about the thyroid that we're giving you. We're going to continue on the subject again next week about the thyroid. We still have a lot to cover on it, right, Cal? It's a multiple segment subject.
Yeah. How can we take care of our patients if we don't take care of ourselves?
Exactly. We are walking testimony.
I work on me more than I work on my patients.
I agree with you, Cal. I am the same way because of your mentoring. I too have the same philosophy. Sure. We have to be a walking billboard, an example that our patients can see and know that we walk the talk.
That's exactly right now.
And
we haven't even talked about Immunical yet. But
no, we haven't.
I don't think I'd be here without it.
Well, that's going to be a subject coming up in another discussion in the future. I want everybody that's listening tonight to, first of all, Dr. Streeter has an incredible story. You can go on the internet and look up his story and be inspired by it. If you look up Dr. Cal Streeter on the internet, you're going to read a very inspiring story. This is a godly man, a godly doctor who inspires everybody that comes to him every day. And now we've got him on the segment on Wednesday nights to inspire you all that are listening and tuning in. And we are both excited to be able to bring this information to you. And we're here to empower you and to inspire you. And go ahead, Cal.
We share with each other, and we share with you.
There you go.
Yeah.
Absolutely. Just a reminder, folks, these are being recorded. These segments are being recorded. So I try to share these recorded segments each week with those that weren't able to watch it. but you can request, if you call me at the office at 386-274-2520. Again, that's 386-274-2520. Call our office if you'd like to get a copy of tonight's broadcast or share it with a family or friend. We're here for you folks. Cal, Dr. Cal, thank you so much again for being with us tonight.
You bet. You bet. I've got a protocol, a thyroid protocol, if people want to see it. I tried to put in print for my kids and grandkids what I do. Okay.
And just as Dr. Cal said, if you want to access these, what we're talking about tonight, the thyroid protocol or any of the information, particularly the recording, let us know. And we'll look forward to seeing you all next Wednesday. Tell your friends and family about this segment. We're on Wednesday nights at 8 o'clock, right on Facebook Live.
Yes, sir. I'll be on time next week.
You're terrific, Cal. God bless. This is Dr. Michael Epitropoulos with Dr. Cal Streeter. We say good night and God bless.
Good night. God bless you. You bet. Thanks, Mike. Have a good